Good afternoon, everyone. I'm Chip Partner, Assistant VP for Communications at the University of Rochester Medical Center. Today begins a temporary furlough period for some URMC employees. We posted a fact sheet describing the furloughs last Friday in our newsroom. This followed email updates to all staff on April 15th and 27th, and meetings last week between managers and affected staff. Here to talk more about the furloughs are three medical center executives: Dr. Mike Apostolakis, our Chief Medical Officer, Adam Anilik, our Chief Financial Officer, and Kathleen Gallucci, our Associate Vice President for Human Resources. We'll invite each of them to speak for just a minute or two, then open it up for questions. Dr. A?
Thank you. I'm Dr. Michael Apostolakis, the Chief Medical Officer for URMC. I believe, as most of you know, about 8 weeks ago, it appeared clear that we were going to see a large surge in COVID-19 patients. In preparation for that surge, we took the elective step of holding non-essential surgeries, clinic visits, and procedures in order to make sure we had enough capacity to care for this impending surge of patients. Due to the social distancing that our community cooperated with and under the guidance of our governor, our county executive, and also our mayor, the surge never occurred, much to the relief of all of us. Unfortunately, fortunately, we did this planning without worrying about finances. Finances were our last thought. Our community and the patients we cared for were our forefront. Unfortunately now, it's been 2 months without non-essential surgeries, clinic visits, and we have 200 open beds that we haven't been using. This has caused financial crisis for us. And because of this, we need to address it. And here to help address it is our Chief Financial Officer, Adam Anilik.
Thanks, Dr. Apostolakis. Just want to kind of talk a little bit about the financial impact that the significant curtailing of clinical services has had on our organization. We've been communicating, some of this information out over the last month, but our latest estimate right now is that our clinical revenue will fall short of budget by $386 million in the period from March to June. We are expecting some increases in our clinical volume over the next couple of months as we start to ramp up services. We're expecting we'll reach 75% of our pre-COVID levels by the month of June. We also shuttered much of our research activities. Those are ramping back up again the week of May 18th, but we are expecting that revenue to be close to budget for the rest of this year. And as everyone is aware, most of the educational activities of the Medical Center and University have transitioned to online learning. In terms of closing the gap, there's really two sources that we can do that with. One is federal stimulus money. The CARES Act that was passed in March of 2020 did provide some grants to us to offset some of the losses we have seen. As of last week, we've received approximately $95 million across the system, which really only offsets about 25% of the revenue loss I mentioned. We also have some short-term cash relief from the government of about $211 million. That repayment starts in the month of August, and almost all of it needs to be repaid by the month of December. So in terms of other steps we took here to address this unprecedented financial challenge, we reduced our capital spending by about $68 million for the rest of our fiscal year, and also implemented additional cost reductions that total about $30 million, which includes both labor and non-labor savings that our next speaker is going to talk about a little bit. So in terms of our overall clinical loss, the initiatives we've identified and the CARES Act money we've received cover about half of that gap. So to talk a little bit more about the furloughs, which are included in the cost reduction of $30 million, is our Associate VP of HR, Kathleen Gallucci.
Thank you, Adam. So it became painfully evident with the gaps that Adam talked about that furloughs were needed to help bridge the gap. And so this action really was taken as a last resort after we explored all other options. It is a temporary short-term measure to reduce costs with the intention of returning staff to work as soon as work volume allows. These short-term furloughs allow us to match staffing levels to projected work volumes and give us the ability to call staff back as soon as possible. Our managers were given flexibility on how to implement, but also had policy guidelines to ensure a fair process. When we look at our furloughs, 81% are partial furloughs or reduced work schedule. It was very important that HR provide a broad array of information and support to both managers and staff, as this has been a very difficult process for everyone involved and something that we obviously have not wanted to do, but it's a necessity now. So when we look at, in the spirit of shared sacrifice, we have leaders, managers, faculty members are all taking pay cuts. And I want to say that volunteers for pay reduction came forward long before we implemented any formal programs. And I think it's been an incredible response from faculty, staff, and students right from the beginning to respond to this crisis. When we look at the financial estimates of taking these actions, the furloughs are estimated at reducing costs of about $11 million through August. And the pay cuts have a reduction in the range of 13 to 18 million through that same time period. I think it's really important to state that our priority, our top priority here is recalling furloughed employees. We want to get them back to work as soon as we possibly can and as soon as work volumes allow. And Dr. Apostolakis is going to talk a little bit more about that.
Yes, the good news now, because of how cooperative the community was with social distancing, reducing the peak of the number of patients we see with COVID, we now meet the governor's criteria for opening for elective procedures, elective visits, and elective surgeries. Our URMC family has totally redesigned from our hospital to our clinics to our affiliates that we now are open for safe visits. What do I mean by that? You'll notice when you come to our facilities that social distancing will be respected. It'll be part of the care environment. Staff and patients will wear masks, and staff will wear other appropriate protective equipment as necessary. We're using new cleaning and disinfection standards to assure a safe environment. And we're testing more patients for COVID. Lastly, in order to assure that we're doing this in all of our sites, we are providing regular audits to make sure that everything is going according to our redesigned plan. With all that, I implore you as patients, you should not put off in-person care when you need it. We're seeing increasing numbers of patients who suffered strokes, heart attacks, and other medical conditions that had they come to get care earlier, they would not have been as severe. Right now, I believe the risk of non-COVID illness, such as stroke and heart attack, are greater than any risk of COVID. With our redesigned URMC, we can provide you with safe care. To read more about this, please check redesigned.urmc.edu. With that, I thank you, and we'll open it up to questions.
And first person I saw signed up was Berkeley Breen from WHEC Channel 10. So Berkeley, you'll get the first question, and Jane Flash from 13 WHAM is next.
Thank you, Chip. Can we go back to that point you just made, Doctor, that you believe risk of heart attacks and stroke are greater than the risk of contracting COVID?
I use those two as examples. We've seen in all of our facilities patients presenting to the emergency room way too late for treatment for acute stroke, for acute heart attack, for heart failure, for other conditions. And this has us all concerned that patients are so afraid of COVID that when they have non-COVID illness, they elect not to come. All our emergency room volumes are down throughout our organization. We've seen over the last week or two it start to tick back up. But for example, we used to have about 300 visits per day in the strong emergency room. It got down to a low of 150. It makes you wonder, where are those other 150 emergency room patients being taken care of? And likely is they just didn't come. Over the last couple of weeks, we've increased to 200 or 250, so we're getting back to where we were. But there's still a number of patients who need urgent care who aren't seeking it, and it has us concerned that they're waiting too long. As far as COVID goes, we've seen over the last 2 weeks a decrease in the number of COVID patients and a stabilization of that. Now, I don't want to say that COVID is not a risk. It certainly is a risk. Not enough patients have been developed immunity from this disease to prevent it from spreading rapidly. So we have to continue with our social distancing as we're doing, but we can provide safe care and protect patients from getting COVID at the same time taking care of their non-COVID illness.
Thank you, Chip. Just a follow-up, Chip, do you mind?
Sure.
When it comes to the two quick things about pay, will those pay cuts be restored when things get back to normal? And if a partially furloughed employee gets called back for a week or two, are they going to get paid as if they worked those 1 or 2 weeks?
Adam?
So in terms of pay reductions, our intention is that they're temporary. Certainly what we'd like to do is, as we talked about, restore services and volume and ramp back up to allow us to restore salaries and bring our employees back to work. If employees are called into work from furlough, they absolutely will be paid for their schedule that they're working. So again, our intention is to bring them back, and they absolutely would be paid.
Thanks, Berkeley. And Kathleen, just to make that point, I think Berkeley was asking, will they be, if I'm furloughed this week and come back next week, will I be paid for this week even though I wasn't working?
So no, for furloughed weeks, employees would not be paid for the weeks that they're on furlough. We do hope that many of them will be eligible for unemployment, and we have certainly done a lot in terms of education and providing tools for them to be able to navigate that process. So we try to provide guidance so that they understand exactly what they need to do in order to apply for unemployment on those furlough weeks.
Thank you. And Jane Flash from 13 WHAM News, and following Jane is Will Astor from Rochester Beacon.
Thank you. Thank you for taking my question. How are the services to the patients in the hospital being given a priority when it comes to these furloughs? I mean, what percentage are hospital cuts, and what are you looking at in terms of being able to keep these services ramped up? Because as we start opening phase 1 and people go back to work, we probably can expect to see some COVID hospitalizations go up as well.
So the furlough process allows for a lot of flexibility. And the way that we did this, we did a shared sacrifice model. So what you'll notice is that 81% of our furloughs are partial, which allows us to actually bring staff back from furlough very quickly and respond to needs in volume. And certainly if COVID were to come back into our community and there were fluctuation in service, partial furloughs allow us really to have that flexibility to flex up and down depending on the needs.
And I can just add that all our clinical sites are fully staffed for influx of patients, and we're fully prepared to ramp up for any surge of COVID patients. We watch admission numbers, number of COVID patients turning positive in the county, and our surge capacity on a daily basis to assure that.
Jane, did you have a follow-up?
Yeah, if I could follow up with a financial question maybe for Adam. On your press release on Friday, it said that you are having losses of $130 million a month. How long do you anticipate that number being an active number, and how long can you sustain those kinds of losses if we should go into a second phase of illness?
So when we talked about some of the financial measures we've taken, that was kind of the bottoming out in terms of looking at the month of April. As Dr. Apostolakis said, as we start ramping up services, we do expect that gap will shrink over time through a combination of both additional revenue for the patients that need services coming in, and also from the cost reduction measures that we talked about earlier. So certainly $130 million a month is not sustainable over the long term. When I shared some of the numbers earlier, we do expect that gap will shrink significantly over the coming months, but really April to June is kind of the time frame when we see the most significant ones, most significant gap, I should say there. But a loss of that magnitude is not sustainable over the long term. So we need to have, you know, a approach that looks at both revenue growth, going back to get to the patients who need to be seen, measured by some of the cost reductions.
Thank you, Jane. Now we'll encourage Will Astor from Rochester Beacon to ask a question. And Will, you'll be followed by Patty Singer from Minority Reporter.
Okay, my question is for Adam also. As part of the flattening of the curve, as I understand it, there is an ongoing reduction in occupancy amounting, I think, for URMC 15 to 30% occupancy reduction. How does this affect revenues ongoing? And in order to deal with any shortfalls, are you expecting any changes from payers to help adjust this?
Well, in terms of the question, so, you know, we are expecting the volume will ramp back up, but, you know, given the need for social distancing, as Dr. Pastelakis said, we don't expect we're going to be at 100% over the next couple of months. You know, we really need to redesign all of our ambulatory settings as was described. We need to maintain, you know, sufficient beds for potential second surge, as you indicate. So a lot of our focus is to, again, as Kathleen Gallucci described, match our volumes of staff with our patient levels, regardless of what level that is. So when we get out kind of the next several months, we do expect that, you know, the losses that were described will shrink given the, again, some of the cost reduction initiatives we talked about. We certainly do expect, though, that there will be losses that continue. The government has provided some support, as I described. We're continuing advocacy efforts, like other industries as well, to kind of help share that. One of the things we've identified is that, you know, across the country, hospitals are expecting to lose $200 billion over the next 3 months. You know, we're part of that, but that's a number that'd be staggering. So, you know, overall, the industry is going to need a lot more support because we don't have a vaccine yet. There may be a second wave, as Dr. Pastelakis described, kind of the social distancing we've done. You know, that's a concern for us. So what we're really trying to do is model out and make sure that our expense base matches our revenue, whatever that revenue will be in the future, whether it be at 70%, 80%, or 90% of our pre-COVID levels.
And Will, but before your follow-up, one technical point, the governor's surge capacity guidelines don't mean that Strong Memorial Hospital can have a maximum occupancy of 70% based on its inpatient census. It's 70% of the surge capacity. So it's a different number, and we can have a larger patient census and still be in the governor's guidelines.
And Will, your second question about the payers, you know, we have approached all of our major payers that do business with us to identify additional mechanisms they can provide to us in terms of financial support, relaxing of some of the criteria for pre-authorizations, et cetera. So we're actively engaged in that. The governor has provided some support to encourage them to work with us to provide, again, some financial support. So those conversations continue.
Yeah, could I get a clarification in terms of that 70% of surge capacity? What does that mean to actual occupancy?
You can answer, Dr. Hayer.
Yeah, our surge capacity is about 300 beds, about 250 beds higher than our actual licensed capacity is 850 beds. Our surge capacity is around 1,100 beds.
So does that, I'm sorry, does that mean you could still be more than 100% occupied?
As long as we can staff 1,150 beds, we're allowed to go to 70% of that number, which is almost our licensed capacity. That's correct.
Oh, okay. 70% of 1,100.
Yes.
Okay.
Thanks, Will. And Patty Singer from Minority Reporter. And Patty, you'll be followed by Brad Patchko at WROC Gen Lake.
Hi, thanks. So in the news release that you put out, you had talked about the percentage of people furloughed from places like the School of Nursing and Health Science Division, things like that. So who were these people being furloughed? Are they environmental service workers? Are they cafeteria workers? Are they I would think that disinfection is very important. You know, how are you handling who is going to be furloughed? And I guess as minority reporter, I'm interested in how this, again, we're talking about disproportion throughout COVID, how that may affect, again, disproportionately the minorities who are also on the front lines here.
Hey, Patty, I'm going to count that as 2 questions.
Well, I'll come back because there'll be extra time and I'll be in the chat again. So there you go.
Okay.
So essentially, we have workers across the institution in every job category that have been affected in one way or another with the furlough process. The furloughs actually were managed at the department level, but they were reviewed by human resources. So every plan was reviewed and matched, really took into account volume, available work in looking at who was furloughed. And again, a large majority of these are partial furloughs. So there's a shared sacrifice in terms of employees in affected areas really sharing in the furlough process in terms of who was furloughed. So again, it's all job categories, very broad based on the work that is available.
Does that, Patty, do you want to ask a follow-up?
It kind of doesn't answer. I guess I'm not really clear on this, and maybe Chip will sidebar on it. I don't want to slow other people down, but I'm just curious. I mean, so is a surgeon furloughed and the person who comes to clean the room furloughed? I mean,
so there's nurses, there's financial, administrative staff, there's office managers. It's really a wide swath of people in terms of who was furloughed.
But Patty, not in active clinical areas. So it's not nurses that are seeing patients in the hospital or in clinics that are ramping back up. It's matching those staff to where the work is. And we'll invite Brad Patchko from WRC Channel 8, followed by Alex Creighton at WXXI News.
Thank you, guys. Just one clarification on what you just answered. So these are non-essential employees that were furloughed, not frontline, like you just said, nurses and doctors, correct?
That's correct.
Okay. Second question, what is the chance that, or projection, I know you probably can't make this call, but have you projected if and when all furloughed employees can come back or will come back?
So I will say one thing, and then I'll let Adam speak a little bit more to this. But I think really by the end of August, we're hoping that we'll be back up to 75 to 90% of operations. And certainly this is unprecedented times, so we don't really know specifically what's going to happen over the next few months. Whatever happens with COVID-19 certainly will inform what happens certainly with our volumes and our ramp up. But we really hope that we'll be back up to at least 75% by that time frame. I don't know, Adam, if you want to add to that.
Yeah, I think, Brad, you're right. It's hard to predict, but as the volume grows, we would expect more and more people to come back. And our goal would be that by the July-August timeframe, like Kathleen just mentioned, that the majority of the people would be back here who are on furloughs today.
And one quick one. I know I had a doctor's appointment last week with one of your physicians in another department. He told me he wasn't called in to help for most of the COVID issues. Do you have an idea of how many doctors you had to call in from other specialties to help, or was it not a lot?
We had made many plans and started training certain physicians for other duties if we saw a COVID surge, but we didn't have to pull in any from other specialties to do any significant number of patients.
Thank you, sir.
Yep.
Thanks, Brad. And Alex at WXXI, followed by Wendy Wright with Spectrum News.
Good afternoon. Can you hear me?
Perfectly.
Okay, very good. My question, in addition to the furloughs and the voluntary pay cuts, a source has told us that physicians, possibly others making over $100,000 a year, are subject to non-voluntary pay reductions of 10%. This would start July 10th and last indefinitely. Can you confirm for us that? And how many employees would be impacted by this? How many people in that pay grade at URMC?
In terms of the faculty, right now we've asked them for voluntary pay reductions at a certain level. So I'm not sure exactly how many would be in the category you're describing, but we've reached out to our faculty to ask if they would volunteer for a salary reduction starting this month.
So there will be no non-voluntary reductions?
Starting in July, all faculty will have a 10% reduction for those making more than 100,000, which is the vast majority.
What about the morale? How are things going at URMC?
I can tell you from a faculty point of view, it's been positive in that we've had over 200 physicians voluntarily take pay cuts because they know what's going on around them, starting in May rather than waiting till July. People are excited about a new beginning and a new redesigned healthcare system that can provide care in this unprecedented time. Other healthcare providers, nurses, staff that I've interacted with have been, I would say, surprisingly positive in their view of the future. All are concerned. No one's happy about taking a pay cut. No one's happy about being furloughed, but the understanding and the pulling together of the faculty and staff in this organization is part of what keeps me going. It's just amazing the response as a whole that we've had.
Thanks, Al.
Thank you.
And Wendy, got a question for our panel?
Yes, hi there. Thank you, everybody. I just had a follow-up to what the governor was saying. He was in Rochester this morning. I'm sure, as you know, he's talking about the Finger Lakes and Monroe County area having met all of the guidelines to reopen for phase 1 starting this Friday. Do you anticipate, and this might be best for Dr. Apostolakis, do you anticipate additional cases of COVID-19 coming in? And how, if that is the case, how could that affect what you're talking about today with furloughs?
Yeah, that's the million-dollar question. I believe that we can open up the economy slowly by continuing to practice social distancing. Once again, this goes back to the public and what a great job they've done so far. Every time I go out, I see someone with a mask. When I stand in line at Dunkin' Donuts, I'm 6 feet behind the person in front of me. They have a plastic shield in front of the person selling the coffee, and they're all gloved. I really believe that the economy can open up by obeying social distancing, by continued masking. And I believe if we do it slowly, we can answer the question that you just asked. We follow very closely the number of cases. We follow very closely the number of admissions, not only in this county, but in surrounding counties. And we've started with the WROC COVID community symptom tracker. The one thing that the community can do for us, aside from social distancing, is to let us know their symptoms every day. And some people will get tired of filling out the WROC COVID questionnaire every day. It's one question: are you feeling well? And if you are, you can answer. And it's important information. If everyone doesn't have a symptom in Monroe County, that's helpful information to us. We can continue to open up and do more of what we're doing. If we see a hotspot through WROC COVID that in one area code, one zip code, we're seeing a lot of symptoms, we can investigate with the Monroe County Health Department as to what's going on there. So we have all these early warning signs of something happening. And if we see an increase in cases, then yes, we may want to close the economy. We may have to, once again in the future, and I hope we don't have in a month or two that I have to come back here and say we have to stop non-essential surgeries and procedures, because then we'll be back to where we were before. But I got to tell you, the community has done a remarkable job in social distancing and masking, and I have high hopes for our community that they'll continue to do it even as the economy slowly opens.
All right, I just typed a message in chat to make sure we didn't miss anyone, but as I look across the Zoom checkerboard here, I think everyone's gotten to ask a question. I want to thank Adam Analik, Dr. Apostolakis, and Kathleen DeLucci for joining us today. Thank Will and Chris and Morgan Underwood from our ASL Interpretive Services for providing our signing support. And thank the media for helping us tell this story in as straightforward a way as we can. So with that, and Lydia Fernandez working the Zoom today. Thank you, Lydia, for doing such a good job remotely. And I think we can end the meeting.